fellow Guyanese, good afternoon. I am Dr. Ertenisa Hamilton, Director of Primary Healthcare Services, and will be providing today's update on behalf of Minister Lawrence. As response efforts continue, a review of our data reveals that much is left to be done to flatten the curve and contain the coronavirus pandemic in Guyana. We continue to see an increase in cases on a regular basis. So what more can the ministry do to convince you that your adherence to advisories, especially physical distancing, is absolutely necessary to bring us back to normalcy, something that you and I have the power to restore? Today we are reporting yet another case. Our confirmed cases now stand at 75, and 15 persons have recovered so far. We have tested 478 persons, of whom 403 are negative. There are 5 persons in our COVID-19 ICU, 19 in our institutional quarantine, and 52 in isolation. Our COVID-19 deaths remain at 8. Of the 478 persons tested, 240, representing 53% of the positive cases, are males, and 238, representing 47% of the positive tested, are females. And now for the global report. According to WHO, there are 2,878,196 confirmed cases, with 198,668 deaths. In the region of the Americas, the number of confirmed cases is 1,140,520, with 58,492 deaths. Today, we continue to have the conversation with you regarding the impact of COVID-19 on persons with underlying conditions. I have with me Dr. Anisha Moore-Thorne, a family medicine specialist attached to the Buxton Health Center. Dr. Thorne?
A pleasant good afternoon. I am Anisha Moore-Thorne, family medicine specialist, presently attached to the Buxton Health Center, East Coast Demerara, Region 4. I speak to you this afternoon in my capacity as a family medicine specialist to bring some awareness to those hypertensive patients who are at an increased risk of developing the most complicated form of the COVID-19. Hypertension, or high blood pressure as it is commonly known, is a disease that commonly affects the middle-aged and elderly populations. Since hypertension is more common as people grow older, that means many of the same people with high blood pressure already overlap with the elderly population known to be at risk for contracting COVID-19 and for developing the very severe complications of the disease should they contract it. This risk worsens even more if the high blood pressure is not controlled. Even though COVID-19 is new to us, what is known is that, like any other viral illnesses, such as the flu, it can damage the respiratory system and make it harder for your heart to work, something that already happens with hypertension. This, in turn, can lead to worsening symptoms. So what can you, as an hypertensive patient, do to reduce the possibility of contracting the virus? You can follow these directives. 1. Keep monitoring your blood pressure as far as you are able and is possible. Remember, it's important to rest for at least 15 minutes before taking the blood pressure. 2. Maintain a healthy lifestyle. That is, exercise for at least 30 minutes, at least 3 times per week, and eat a balanced diet, low in salt and oils. 3. Keep taking your medications. Ensure that you take them as prescribed by your doctor. Right dose, right time. 4. Avoid stressful situations, or, if unavoidable, manage them well. 5. Follow the same guidelines put forward by the Ministry of Public Health. Wash hands frequently and properly using soap and water, especially if they are soiled, or use an alcohol-based sanitizer if your hands are not soiled. Resist from touching your face, especially your eyes, nose, and mouth. Stay home unless it is absolutely necessary that you have to leave. If you have to leave the house, wear a face mask. This will help in practicing good respiratory hygiene. Maintain physical distancing when out in public places. Stay at least 3 feet away from other persons. Thank you for listening. Do practice what you have heard.
Thank you, Dr. Moore-Thorne, for this message to our hypertensive population. Fellow Guyanese, we appeal especially to persons with comorbidities to take extra precaution. You may encounter many defeats, but you must not be defeated. Let's endeavor to defeat the coronavirus disease. Stay safe, stay alive. Thank you, and good afternoon.